Since the recording of our last video, there have been important updates to our rectal irrigation practice. These changes address practice modifications and alert us to the potential risks. In this video, we are going to demonstrate how to perform rectal irrigations. Begin by gathering all your supplies, including irrigation instruction pamphlet, 2 diapers, water-soluble lubricant, a Foley catheter, a 60 milliliter catheter tip syringe, hand sanitizer, saline, and a non-sterile basin. Prepare to give a rectal irrigation. Begin by washing your hands and donning gloves. Pour about 120 milliliters of the saline into the basin. Open a diaper that will catch the irrigated fluid and draw up 20 milliliters of saline into the syringe. Position the child on their back with legs in the air and knees bent. Put lubricant on the tip of the catheter and place some on the anus. Measure and hold the catheter 6 inches from the tip and insert the catheter into the anus and stop at the 6-inch mark. Place the open end of the catheter into the extra diaper. Allow all of the gas and stool to escape the catheter by gently moving the catheter back and forth. Attach the saline-filled syringe to the catheter and inject the saline. Remove the syringe from the end of the catheter, but leave the catheter in place. Slowly move the catheter back and forth in the rectum and the descending colon, as this may help to find pockets of stool and gas that are stuck in the colon. The helper holding the legs may also gently massage the abdomen. Also, do not advance the catheter further than the Y ports. It is important to wait between each flush for the same amount of fluid to drain back out of the rectum. If the 20 milliliters you just flushed through the catheter flows back out, then keep repeating the steps until the fluid coming out is clear. Do not force the catheter to go in. Sometimes gently twirling the lubricated catheter helps. Important summary points. Use a Foley catheter and insert it 6 inches at first. Never insert further than the Y connectors. Allow gas and stool to escape through the catheter. Use the back and forth technique, minimizing insertions into the anus. Instill 20 to 30 milliliters of irrigation at a time and let the installations come out between. Do this as many times as you can until there's no stool coming back out and the stool is clearing. Currently, the only type of catheter utilized for this procedure is the silicone Foley catheter. However, the similarity between the balloon and irrigation ports poses a risk of inadvertent inflation of the balloon. Such an error can lead to potential colon injury, so it is essential to ensure that the correct port is used for irrigation. For recommended equipment, only piston syringes, as shown in the image, are to be used for these procedures. This ensures that the syringe fits properly within the Foley catheter drainage port and functions as intended without causing harm or inadvertent balloon inflation. It is now recommended to tape off the balloon port of the Foley catheter to avoid accidentally inflating the balloon during rectal irrigation. This is a simple yet effective step to enhance safety during the procedure. We conclude with a key update. Ensure the Foley balloon port is taped off to prevent inadvertent inflation and utilize a piston syringe.